Now, I would like to give the floor to the first speaker of this conference, Dr. Jurgita Rimkevičienė, who defended her doctoral thesis in 2016 at the Australian Suicide Research and Prevention Center. This is why probably we always have speakers from Australia. Jurgita's thesis was defended at Griffith, and since 2016, Jurgita has been working at the Vilnius University Suicidology Research Center and has been conducting various studies and research. And she is the trainer of suicide prevention and a counselor, a therapist. And as we have said, Jurgita Rimkevičienė's presentation today is Suicide in Lithuania. Are we any different? Good morning.
Good morning to all. I'm happy to be here. I will share my slides. I would like to present the results of the study that has been conducted together with my colleagues, Paulius Skuruibis, Dr. Dovilė Grigienė, Dr. Zaida Dashev, Professor Danutė Gailienė. This study was a wide study on the general population, aiming to understand what are the thoughts about suicide about in Lithuania and what are the events or circumstances that have to do with it, and how it relates to the general suicidology theory. Are we any different? So I'm very happy to share the results. I would like to start with the very problem of suicide. As Paulus has mentioned, the suicide rate is going down in Lithuania, and we are very happy about that. But how Simona said, you are always afraid of being too happy about it because it's not the end. You cannot prognose it till the end, but there are some factors that influence the changes in the society. Sometimes you want to be cautious when you see this rate that is going down, because when we see the deaths who fall into other categories but could have been suicides, we are very cautious looking at the statistics, because some of the suicide cases just escape our statistics. There are several factors. For example, unclear death reasons. There were many cases in these categories. Now this category is going down. But still it is 1.5 times bigger as the European average. For example, there are other categories, unspecified death reason. It's also bigger or higher than the European average. And one more thing is the accidental dying of drug. And this is strange because in Lithuania there are less cases in this category than in the European Union. We can see that in the statistics, not everything comes into it. Something is escape. Some cases escape of the statistic. This is normal. Not everything can be broken down into these categories. So, and at one hand, we want to express joy about the statistics, but still we should be cautious. If we speak about rates by age group, we can see that in all age groups the rates are going down. 35-49-year-old in this category, men, the rate is going down. Still, the The age of old people still doesn't change. The rate in this group is not has not been changed. So most probably our policies have effect, but not for all age groups. So I will try to speak about these statistics and these effects. Going back to our study, what we wanted to research. The theories developed in cultures with low suicide rates in the USA and Australia. These theories have been created in low suicide rate countries. But in Lithuania, we have much more suicides. Do these theories work as well in high-rate cultures as Lithuania? Are there any differences? One of the most popular theories in suicidology nowadays is interpersonal psychological theory of suicides created by Joyner. Here we have several factors, sorted belongingness and perceived burdensomeness. And these two factors, when they come together, the suicide wish is very strong. And there is one more factor is the capability of committing suicide. This is an acquired factor that embraces various sub-factors. So this factor also contributes to coming to action. So this is one of the theories, one of the most popular theories nowadays. The second theory is created by O'Connor, integrated motivation will model. This is a more complicated theory with various factors. Defeat and entrapment is one of the major factors in this theory. Here we speak about a difference between people who think about suicide and people who just feel bad because they feel neglected or something else. So the defeatment and entrapment is one of the major factors in this theory. What is unique about Lithuania? We have been studying all these factors in the Lithuanian context, and we have looked if we have any specific socio-cultural circumstances. These theories receive criticism because saying that they do not take into consideration social factors in countries. Like in Lithuania, we have high alcohol consumption, perfectionism, negative childhood experiences. And when we conduct studies about we see that the negative childhood experiences and traumas, these rates in Lithuania are higher, and this also has to do with the suicidality. We also have negative opinions on seeking help. You should be perfect. You should not show your weak points. And our study was the aim of our study was to look at these social cultural norms and to see if the theory is enough or these cultural norms also affect the suicidality. We started with the network analysis approach that first of all was started to apply in physics. The idea is that each element has to do with each another element, with every element. In the mental health sphere, we started to understand that different as in other medical fields. For example, in oncology, we see that cancer cells can influence the pain or other dolences or aches. We can see that in mental health, it's not the case. In mental health, there are many interrelated things. For example, in the case of depression, there's insomnia because the person has thoughts, bad thoughts, and then when you cannot sleep, then you cannot think clearly about the situation, then this leads to anxiety. This anxiety in its own leads to problems in the relationship, and each symptom has an effect on each other symptom, and they interact. So here we can see how these symptoms affect each other and what is the result. And we think that in the case of suicide, it's the same. During many years, the opinion was that the suicide was the result of many individual factors. And we see this scheme that all these factors interrelated, they have an effect on the suicidal thoughts and suicidal actions. If we measure it on the basis of network analysis approach, we can see that the change in one element can have a change on the networks. For example, if a person sleeps well, everything changes for better. Or if he feels entrapped, it has a general effect on all the network. The person thinks about suicide or not, if he goes to an action or not, it has to do with the general network situation. If you see suicide in the network analysis approach, you can see the situation in a broader sense. So the aim of our research was to see if all these factors are relevant in Lithuania. Is it only important to take into account theoretical constructs, or also include social cultural factors? In our study, the sample was with minimum quotes by sex, age, and place of residence, 1,873 participants. There were more female participants, but still we tried to include both people from the city and from the rural areas. We can also say that this research is very representative for suicidality in Lithuania, because data was collected in the year 2020 and 2021. And the research was funded by Lithuanian Research Council. We had a number of questionnaires for suicidality, theoretical constructs, symptoms, cultural constructs, for example, gender role conflict scale, perfectionism, childhood experiences, social comparison, am I better or am I worse, and childhood experience as far as the relationship with parents is concerned. So what were our results? The results of network approach analysis is such a colorful map. I will try to explain it. First of all, in general terms, how all these factors have to do with different suicidality aspects. Suicidality aspects are in pink. They are four: the history, how far a person has gone in his or her suicidality, has suicidal thoughts, has been planning a suicide, or has taken any action. Have there been any attempts, suicidal thoughts in the last year? How often they came to this person? The third factor is communication. How much the person is prone to speak about the suicidality, and the risk. The risk perceived by the person. Does he consider that there is a risk that sometime in his or her life he or she will commit suicide? So the risk factor is very important. It helps us to understand how is it probable that the person will come from the suicidal wish, to the action, because the suicidal thought does not kill a person. And we have studied what is related to these factors. A very interesting thing was that the childhood experience has a very clear link to the history. And what we thought is the emotional negligence. If the person feels that I have never been important, my emotions have never been important, nobody cared about me, this will have a very clear link to the person's history, suicidal thoughts. It's not the violence, is the emotional negligence on the part of the parents. This factor is very important, and it relates all the childhood experiences to the societal history. There's only one but. Sexual abuse had to do in the childhood had to do with all the suicidal factors. It's usually women or girls who have experienced sexual abuse in childhood, and they say that they have had suicidal thoughts at least once a year. But the suicidal thoughts nowadays had not to do with the sexual abuse. And we thought, why is it so? It's very important. This experience in other researches show that people do not understand very well what is happening to them, and from the thought come to the action faster. They do not say that they think about the suicide. They just start hurting themselves or committing suicide. And this is very important when we think about the suicide risk measurement. If a person has had sexual abuse history in childhood, this is a very unexpected but very important finding. One more aspect is that restricted emotionality had to do with the communication. If the person communicates his suicidal thoughts. What is restricted emotionality? People who say that it is difficult for me to show my emotions to others, they would not be very keen on speaking about their suicidality. And this also has to do with emotional negligence. If a person felt in the childhood that his or her emotions were not important in childhood, now as an adult, He says that it's difficult for me to show my emotions and would not speak about the suicidality.
Suvokiantis psichologinės
Also,
pagalbos.
these people who said that they think that psychological help is important and helpful, they would be the ones who would communicate their suicidal thoughts. How much if I understand the help, that the help is helpful, then I would communicate.
Jeigu taip galvojant apie
Even when we think about the theoretical factors, out of all the factors, the feeling of burdensomeness has been exceptional. And in our studies, this feeling of being a burden, a subjective burden to the others, is one of the most important factors, and this implies a higher suicide risk. It is also related to the fact that an individual expresses more often to the others that they are thinking about suicide. In other studies, the feeling of being a burden is related not only to suicidal thoughts, but also to the fact that the person is going to take action in terms of suicide. So if the thought is that the feeling of belonging is related to the feeling of thwarted belongingness is related to other aspects. The feeling of burdensomeness, perceived burdensomeness, is especially important, and especially in Lithuanian culture, due to its actions, due to being perfectionist. When an individual is always lingering whether they have done things well or badly, how do they evaluate their actions? And this is very typical of our culture. If, for instance, in the UK, in other theories, there is a strong feeling about to what extent should I look perfect in the eyes of the others. In this study, this was not actually related to perfectionism. To our culture, being perfect, perfectionism seems to be very important. It's constant blaming of yourself. It's constant thinking about whether I'm doing it right or wrong. And it's very important to take this into consideration. So on the other hand, perfectionism has been a very important element on the changes, because when the changes are small in the area of perfectionism, this has the biggest impact on the whole network. So when you blame yourself or when you belittle yourself, this is a very important intervention factor. This is a correlation study, not a longitudinal study. And maybe we can find certain causal links. But this allows to assume that this construct is extremely important. Another important construct is the use of alcohol to undermine the emotions. And in our culture, it's not the quantity of alcohol consumed, but more the objective for which alcohol was consumed, and this was related to suicide. And as you see, this factor doesn't belong to any separate group. It's exceptional because it is less related to the individual's feelings of burdensomeness or perfectionism, and it is very closely related to suicidal thoughts. No, not. It doesn't actually mean that when you use alcohol in order to weaken your feelings, you will necessarily think about suicide. No, but this factor should be taken into account. And the thought is very important, not the quantity, but the objective of using alcohol is very important. This is important because when we evaluate the alcohol consumption, we think about quantity consumed, but when thinking about suicidality, it is important to evaluate whether they are consuming alcohol in order to overshadow your feelings, to avoid your feelings. So all those socio-cultural actions which are directly related to suicidal are very important. Emotional neglect, restricted emotionality, perfectionism, defeat and entrapment, and abuse, alcohol abuse. Among all of these, the most exceptional one is, most exclusive one is perceived burdensomeness, and we have carried out the network analysis, and we see how these factors are interrelated and to what extent each factor may have an impact on the whole network. And we see the right column, the expected influence and its emotional smart, and these are childhood emotional violence and neglect, emotional neglect. These are childhood experiences, and they can actually have an impact on the whole network. Now, coming back to sexual abuse in childhood. In our study, it was mostly women who experienced sexual violence, 16% among them. And among those who had experienced sexual violence, approximately 70% had thought about suicide at some point in their lives. I wouldn't like to say that this study reflects the Lithuanian population in terms of the suicidal thoughts. Of course, that means that this study could have attracted more people who had had this experience, and that has allowed us to evaluate more specifically how these constructs, how these factors are distinguishable. Of course, there were men who had experienced sexual violence, and among them there was a large share of individuals who had had suicidal thoughts or attempts at some point in their lives, but not during the recent months. Now, very often when we think about the suicide and suicidal risks, we think about depressions. And one of these depression thoughts are related to the wish to die. There are so many interventions in the world regarding this. Here, we did not think about the clinical interviews. We have the self-surveillance questionnaires that evaluate depression symptoms and how these symptoms are related to suicidality and theoretical constructs. It is only obvious that when evaluating depression, there are thoughts, passive thoughts about the wish to die. They are related to suicides. Those who want to die most often want to commit suicide. Interestingly enough, that out of all the symptoms, there's a feeling that I'm a loser and I'm disappointed and powerless. These were the two symptoms that were mostly related to suicides, and this is repeated in all other studies all over the world. So when you evaluate the depression, these two symptoms are extremely important. If they exist, there are stronger thoughts about death and suicide. However, what is very important is the subjective risk. To what extent does the individual say that it is a high likelihood that they will take action and commit suicide? This was not related to any of the depression symptoms. The direct relationship was only to the feeling, to the thoughts about suicide. But you see that the feeling of burdensomeness, and we have the direct relationship marked by blue lines, and the red lines indicate that when one becomes stronger, another one becomes weaker. So the wider blue lines show the stronger links. And you see that there's a very wide link between the risk and being burdensomeness. So the subjective risk to commit suicide is very much related to being a burden. That the burdensomeness feeling was very much related to communication. That is, the person was more inclined to express his thoughts loud about thinking about his suicidal thoughts to the others. So here, when evaluating only depression symptoms, we overlook a very important symptom: to what extent the person is feeling being a burden to the others. And we may miss this important link. This is very important to everyone who is working with diagnosis. That is, even when you evaluate a depression diagnosis, when you detect this diagnosis, the feeling of burdensomeness is very important. Another aspect, we were evaluating to what extent what factors are associated with the severity of current suicidal ideation. And at the moment, when we work with people having suicidal ideation, it is very important to evaluate what they are experiencing at a specific moment, but such analysis is very difficult. At our study, we had 363 individuals who had suicidal ideation during the recent month. And we thought, what factors are related to the current suicidal ideation? So if we take the depression gravity, we see that the frequency of suicidal ideation during the recent month was related to what extent the individual was feeling disappointed, sad, and powerless. Other aspects, to what extent were the thoughts tormenting, and whether the individual felt they could control the ideation. This was not related to depression symptoms. They were rather a reliable forecast for the frequency of such ideation. However, to what extent did the thoughts affect one's life? We know that depression symptoms affect an individual's life. And this is also related to increased or decreased appetite. So actually, suicidal ideation affects an individual's life and creates certain difficulties to function. However, again, how close was an individual to suicidal attempts during the recent month, or attempt a suicide, or was close to that? Here we have the SIDAS scale to evaluate the intensity of ideation during the recent month. So this is the evaluation of the subjective risk that the person is not only thinking but will also take action about suicide. So this again was related to the feeling of burdensomeness. Now regarding the depression symptoms, and the tempo changes, whether this slowed down or activated everything that I'm doing. So in this questionnaire, we have the evaluation of the tempo, whether the actions have become slower or faster, whether actually this is related to agitation. And that's one question to measure that. And in this case, there's a high likelihood that the agitation and faster tempo is related to suicidal attempts. We had only 2 constructs, so therefore we did not evaluate all of them very specifically. So out of all the symptoms, only tempo is related to suicidal attempts. We also see that disappointment and the feeling of powerlessness, helplessness, it was objectively related to suicidal attempts. If this ideation is not frequent or a person feels sad, they are more inclined to express that they are thinking about suicides. Irrespectively of all the depression symptoms, this feeling of burdensomeness is the foundation. And in our culture, an individual actually most often think about being a burden before taking a suicidal action. And now there's the evaluation of how often the individual had suicidal thoughts in the last month. So we have the depression, and in terms of network analysis, depression, some symptoms are separate. Maybe this summing up is not the most appropriate. We didn't have the statistical capabilities to put that inside that wide network, but we see that depression remains very relevant in terms of the intensivity of suicidal thought. And when we go back to the feeling of burdensomeness, this, among all the theories, was the most frequent factor related to suicidal attempts of an individual. Now we have to go back to the last months of suicidal thoughts, and this was actually very much related to sexual violence experienced in childhood. Usually, such individuals who experience sexual violence in childhood say that they do have suicidal thoughts, but this does not necessarily affect their lives. So we can share our hypothesis. What does it mean? When we think about the sexual violence experience, this may have been related to the chronic suicidality, when people are tortured by suicidal ideation for a long time, but they are so much used to that that people are able to hide them easier, and their lives are not affected by that. But this ideation is still tormenting. So the childhood sexual violence experiences are important when evaluating the importance of suicidal ideation through during the last month, and I think whether we ask questions about that when we start thinking about suicidality, when we have an individual in our clinical practice and we work with them and they thought about suicides. These are secret and shameful experiences which people normally don't want to share. So when I review this data, I sometimes get the question how often I miss. Um, I do not think about that. And in this analysis, we see the algorithm that these bubbles come closer together when they are interrelated, and they are further from one another when they are more detached in terms of network analysis logics. So now we see that sexual violence experiences are very close to suicidal ideation and experience. Again, we have perfectionism directed towards oneself, and this is very much related to how much suicidal ideation has affected an individual during the last month. So this is blaming oneself when feeling that I have to be perfect. Now, when we move on to the differences between age groups, we didn't have the possibilities to research the group 70 plus. We see that the suicide rate is the largest among that group, and the study shows that the older the people, the less frequently they open to the fact that they had suicidal ideation or attempts. And frequently in this research, in this study, almost 50% of people have had suicidal thoughts at some point in time. In our study, we saw that the suicidal thoughts, suicidal ideation was 4 times more frequent than expressed in other studies. And this is relevant to the studies carried out in other cultures. Young people express that are open to the fact that they had some suicidal ideation or attempts. And while an individual is older, then they are less open about that. Now, we have had this network analysis. Our capacities are not sufficient for such a big sample, but if we look at the regressive analysis, we analyze to what extent, what factors were related to the suicidal ideation, and it was mainly the feeling of entrapment, especially among those in the age group of 20 plus. Now, the feeling of burdensomeness is relevant for those under 30 and from 30 to 50. Emotional neglect is also very a powerful factor even for the older age groups. And the previous suicidal attempts are relevant only in the age group from 30 to 50. Actually, the depressiveness could not forecast the intensity of such thoughts, especially when we think about the middle age group. It just explains whether an individual has such thoughts. Now, in the youth group, the consumption of alcohol as the method to manage strong feelings was also related to the suicidal ideation. In the age group 30 to 50, the marital status was related to suicidal ideation or the previous suicidal attempts, depression symptoms, or self-blame. So when we think about young people, this is related to adaptation and social status and hopelessness that something will change, and alcohol consumption. These are adaptive factors. Regarding the middle age group, this is related to the feelings of belonging, the lack of this feeling, and the difficulties in overcoming those difficulties. Regarding the age group of 50 plus, it was the feeling of entrapment that led to suicidal ideation, and more often these ideas were typical of women with higher education or experiencing other emotional difficulties and doubts regarding one's actions. Now, regarding the factors forecasting the intensity of suicidal ideation, it was mostly related to individuals who have a better financial situation, and it was mostly related to
gyvenimo ribotumu. Gerai darau ar blogai darau.
to the fact that an individual was in a in good financial status, and now if we bad financial status and better physical status.
What could be the conclusions? I have spoke a lot, but what is the portrait of a person who thinks about suicide? I have to be perfect. I question everything I do. I find it difficult to show my emotions to others. I feel depressed, helpless, and a loser. I feel I am a burden to others. These are people who have suffered from sexual violence, who use alcohol to hide their emotions. These are people with whom we try to establish a contact and whom we try to help. These are not the people who will go into a contact by themselves, who would actively look for help. They are not very sure if their emotions are important, if the help will be helpful. And we saw that this lack of cooperation is one of the hardest things for people, for professionals who worked with patients who later died by suicide. This was one of the major problems, this lack of cooperation. Not the fact that it is difficult to rate the suicide risk or think of what to do with such a person, but to have a contact with this person. This suicide prevention works through a contact. You can only help a suicidal person if you establish a contact. And for the suicidal people group, it's very difficult to maintain a contact, go into a contact. So I think that assessing suicide risk, cooperation is very, very important. How could we help these people? We should create the feeling that the psychological help is helpful, because psychological help has to do with sharing thoughts about suicide. We should look for windows of opportunities for intervention in order to give them a positive cooperation experience. This is what we could do with this group, with which the major issue is cooperation. So I would like to stop here. And now it's time for questions, most probably. Thank you, Jurgita, for a very interesting presentation. I would like to say that in the slide platform, you can raise questions. I see that there are questions already. We will prioritize the questions that will have to do with the presentation, because we do not have so much time for questions. 5-7 minutes. First of all, a couple of comments. It is a very interesting and a very helpful research, a very informative scheme that allows to see a very complex situation and mechanisms. Now I go to the questions. What could be, how could we work in clinical practice with patients who doubt about their own actions and are perfectionists? You have told us that these two things, the perfectionism and doubts about one's actions, are very important factors. How should we work with such people? First of all, I would ask, what is it all about? What is hiding beyond this doubt, continuous doubt and perfectionism? Why is it important for you to be perfect or to seem perfect? I would suppose that there are experiences of helplessness, or experiences that I am not important, my needs are not important, therefore I should meet certain standards. We should try to understand, what is this helplessness about? Why is it so difficult to deal with the helplessness? How would we look for ways of being with this helplessness without this constant perfectionism to do everything right? If we go into a discussion, is it good or is it bad to be perfectionist, it will lead nowhere. But if we go into the emotional background and the emotions that are hiding beyond this perfectionism, we could look for ways to deal with the situation where one thinks that he's not perfect. If it is difficult to cooperate with a specialist, could we expand our mental health help network through community centers, municipality centers? Would it be easier to cooperate and to go into contact in such a way? Here I agree, but still there are several buts. In this research, we have shown that these are the people who have difficulties in general to make a contact, in general, not only with a specialist. If we have a network of safe relationships, safe cooperation, safe being together, where emotions are important, they are heard, and you look for solutions. If we have more networks as these, this is good. It is very good to see other people who have experienced the same problems and they received help. This is also good. It is very good to have a possibility to go into a contact with people who have experienced the same situation. But it will not be easy with the group of people who cannot go into contact or they have difficulties. This is the difficulty that they have. That is why we have difficulties in this. And the last question, you have spoken a lot about that. The title of your presentation is how are we any different in Lithuania? Could we make like a generalization? What are the major differences if we compare Lithuania with other people? The major difference is the perfectionism towards oneself, perfectionism about my own actions. It is very, very important in Lithuania. Am I doing it wrong? Am I doing it well? And also the restricted emotionality has to do with our experiences. The emotional neglect, we could also see that it's very Lithuanian. And if we speak about the theories, so the perceived burdensomeness is very, very important in Lithuania. If we go back to restricted emotionality, what is it? I don't want to show my feelings. It is difficult for me to show my feelings, especially if they are strong feelings. I don't see any reason for that. I am afraid that I will not be understood. So this trying to not show how I'm feeling, it is very, very important in our culture. And it might have to do with emotional neglect. When we saw these two factors so close in our research, it might be very logical if you have felt all your life that your emotions are not important, so why should you show them? And we see what is important nowadays, for example, children's rights. This also has to do with what you are saying. We as a society should go a long way in order to understand what is the emotional neglect, not only the physical violence, emotional neglect where a child becomes hostages in a relationship of adult people. Thank you very much.